As the first people of Nova Scotia, we've asked members of the First Nations to officially open the second annual Health Equity Forum. Carol Lawrence is here with us today. She's worked with financial services at the Department of Health and Wellness for many years now, and she's been helping out and working with the Diversity Committee, but she's now a full-fledged member of our committee, and we're very happy about that. So Carol is going to open the forum with the Mi'kmaq prayer. Thank you, Carol.
The cases of domestic violence, including missing and murdered Aboriginal women and children, is alarming, yet many cases go unreported. I myself experienced domestic violence in my first marriage, along with my 2 small children. Had it not been for my younger sister, who has been a healthcare professional for many years, I would probably still be in that situation. As a member of the First Nations, I am pleased to be here to open this event. I am certain today will be very informative and perhaps difficult at times. Together we will support and learn from one another. Quay. Ojiniskam, O Great Spirit, whose voice I hear in the winds, and whose breath gives life to everyone, hear me. I come to you as one of your children. I am weak, I am small. I need your wisdom and your strength. Let me walk in beauty and make my eyes ever behold the red and purple sunsets. Make my hands respect the things you have made, and my ears sharp so I may hear your voice. Make me wise so that I may understand what you have taught my people, and the lessons you have hidden in each leaf and each rock. I ask for wisdom and strength, not to be superior to my brothers, but to be able to fight my greatest enemy, myself. Make me ever ready to come before you with clean hands and straight eyes, so as life fades away as a fading sunset, my spirit may come to you without shame. Walalan. Courtney Pinnell is a Mi'kmaq from Acadia First Nation. She is a second-year nursing student attending St. FX University. She is a student assistant to the Aboriginal Student Advisor, as well as president of the Aboriginal Students Society. She is a jingle dress dancer who follows the Red Road, traditional way of life. Her dream is to one day work on life flight. However, her focus and concern is on health care for First Nations people and obtaining her RN degree. Courtney has participated in several Aboriginal awareness events held by the Department of Health and Wellness Diversity Committee. Today, she will be sharing her thoughts on domestic violence. Courtney will also share her vision of how the healthcare system could benefit by engaging with the Aboriginal community and by sharing different ways to support prevention and treatment of domestic violence in diverse communities. Please welcome Courtney Pinnell.
Good morning, everyone. I was asked to speak on support for a health professional to prevent abuse and to serve survivors of abuse, and how best health care professionals can learn from and work with Aboriginal communities to support prevention and treat abuse in and out of community, and also my vision for a future health system that engages and respects Aboriginal people. Trust is key. You cannot build trust without understanding and acknowledgement. Therefore, education is crucial. Secondary to that, I believe cultural safety would also be key. Cultural safety takes us beyond the following: cultural awareness, the acknowledgement of difference, cultural sensitivity, the recognition of importance and respecting difference, and cultural competence, the focus on skills, knowledge, and attitudes of practitioners. Cultural safety is predicted on understanding the power differentials inherent in health service delivery and readdressing these inequities through educational processes. All healthcare providers must begin with understanding the historical impact of colonialism in the residential school era, real truths, contemporary lives of First Nations, Inuit, Métis, and what still happens as a result of colonialism and its generational effects. This is sometimes acknowledged as historical trauma. The suffering that's been inflicted as a consequence of Canadian laws, health disparities and inequities, and the determinants of health. Basic human rights are out of reach. With the way things have progressed and became westernized, we now have no choice but to use a two-eyed seeing perspective. When I speak in terms of our or my, I'm speaking from a First Nations perspective, so as Aboriginal people as a whole. Our bodies have adapted to very sedentary lives and processed foods, new drugs and disease and alcohol, misuse of tobacco, etc., from how we used to be in our traditional lifestyles. We now need to use Western medical surgical methods to help cure ailments such as diabetes and many other unheard of diseases, or once were unheard of to our people. We must remember and still respect traditional values and healthy methods. Culture is a way of life. It isn't just values or food or clothing or language. It is someone's every fiber of existence. You cannot just out with the old and in with the new. Aboriginal people have proven resilience time and time again. Before someone can fix anything, there needs to be a self-assessment done as well. There's a need to develop competencies that equip people not to only be culturally sensitive, but to have deeper and more sophisticated understanding about the health and well-being of Aboriginal people. Since human beings tend to identify with care providers who look and speak like them, it would be beneficial to employ more Aboriginals across all sectors of the healthcare system, including rural, northern, and urban contexts. A vital part of Canada's future lies in maximizing the lives and opportunities of Aboriginal people, as demographics for Canada show a growing and racially diverse population, with Aboriginal youth being the fastest growing. By 2017, 1 in 25 Canadians will be Aboriginal. Furthermore, the Aboriginal population will be larger and more influential than in any point of history. Policymakers must also understand what cultural safety fundamentally means. The difference it makes to policy development and delivery, where cultural safety lies, conceptually and in practice, in relation to previous considerations of cultural difference. By considering social and cultural implications of Aboriginal post-contact history, the concept of cultural safety can contribute to a greater understanding of the origins of these crisis situations and how policies can be developed to address them. Institutions such as government, hospital, clinics, schools, etc., must demonstrate cultural safety and competence in order to effect cultural change in the design and delivery of policy. Insight towards the Aboriginal cycle of life would also be beneficial. The cycle of life is based on stages, which correspond to 4 seasons, directions, elements, and gifts. The aspect of holistic health represents the physical, mental, spiritual, and emotional traits of the individual, family, and community. My vision for the future is to have Aboriginal people, including elders and residential school survivors and healthcare providers, sit on some type of healing committee within all communities and create and implement a plan that's inclusive and supportive, that respects traditional Aboriginal healing methods. Our identity needs to be brought back to us, our values, our love, our respect, language, and family ties. Monetary handouts do not cut it. There needs to be action, not just money, rewards, and apologies. Take the money and put it where it counts. Create healing centers in Aboriginal communities equipped with professionals who are either intensely trained with Aboriginals or who are Aboriginal, as well as elders or medicine men and women who can conduct sacred healing ceremonies in conjunction with today's modern, westernized technological advancements. We must begin to see the best of both worlds. Aboriginal youth need to take a stand and take back what's rightfully theirs. Through community healing, Aboriginal communities are able to effect preventable and remedial programming, drawing on strengths of Aboriginal knowledge, culture, and traditions within the community. As individuals and communities, many Aboriginal people suffer from health and safety risks that appear as catastrophic failures within a wealthy modern society. In a beautiful, rich country such as Canada, it is a complete and utter disgrace that in 2012, Aboriginal people are still suffering. In some areas, living conditions are graded as third world. Where are our human rights? I'm standing up for a change, and I have a lot of faith in the upcoming generations to create the necessary change and bring back equity and equality for our people. Thank you.
Thank you, Carol and Courtney. I guess it really highlights the importance of understanding the history and the impact of that history on the lives of Aboriginal and First Nations people, and that we need to keep this in mind when we're making policy in collaboration with people of the different communities. So thank you very much for that. So I'm pleased now to welcome you to the second annual Health Equity Forum, brought to you by the Department of Health and Wellness Diversity Committee. You'll know who we are. We have these t-shirts on, lovely t-shirts. The t-shirts, and some of us have the buttons on, so you should be able to pick us out. So the Diversity Committee members and the facilitators will have these. Today, we're talking about domestic violence, and it's a topic that touches everyone. Most people know someone who has experienced domestic violence. Last year, at our first Health Equity Forum, we had a moment of silence for Dr. Attilia Chirella, who had just been murdered by her husband. It brought home the message that domestic violence is very real in our society, and it has a devastating impact on family, friends, co-workers, and the community. I want you now to think about the people that you know and the many who have been impacted by domestic violence. So let's please observe a moment of silence for all of those who have suffered and those who can no longer speak for themselves. I'd like to announce a project that just started. The Domestic Violence Action Plan Committee, they started a soft launch of this, it's called the Dialogue on Domestic Violence Project. It's an electronic tool that enables the group to collect firsthand experiences from those that are affected by domestic violence. This includes those who have experienced abuse, those who have been abusive, service providers, friends, and family. The project was just launched in across 7 government departments, and it's been promoted in 2 communities, Sydney and Lunenburg, promoted at St. Mary's University and through the Transition House Association of Nova Scotia. So we're pleased to tell you about the project today. We do have some posters around, I believe. They might be out at the front desk, so it would have the website address there. And I understand that it is early, so there might be some kinks in the system right now, but this will be launched and it will go broader as time goes on, so keep your eyes open for that. Right now, I'd like to introduce Sharon Davis Murdoch. She's been with the Nova Scotia Department of Health and Wellness for about 20 years. Sharon, let's count them, 20 years. I've been there for about 16. While with primary health care, Sharon led the Diversity and Social Inclusion in Primary Health Care Initiative, and one of the outcomes was the development of the first cultural competence guidelines in Canada. And I'll just say that she won the Premier's Award of Excellence for that work. I didn't need to get that. I just thought it was important that people know that. So Sharon now continues her work as the Special Advisor to the Associate Deputy Minister for Diversity and Social Inclusion. She's co-chair of the Diversity Committee with myself, and her passion and undeniable passion is very infectious. She's going to provide us with an overview of the day that we have ahead.
Good morning, and again, welcome. The Department of Health and Wellness Diversity Committee's second annual Health Forum is really pleased to see you all. It is gratifying to see old friends and new, and it is important that we do see you as we continue this compelling journey toward health equity. Again this year, the forum will build health system knowledge. However, especially this year, we have the tremendous opportunity to entrench health equity and cultural competence in the department's Domestic Violence Action Plan. And this is an essential component of government's overall Domestic Violence Action Plan. Specifically, the Department of Health and Wellness is committed to work in this area that includes the development of domestic violence policy and guidelines for use in primary care and allied health professional settings, the development of domestic violence training for health professionals, the development of related curricula for students in the medical and allied health professions and training partnerships. Soon, we will hear from our Diversity Committee members and colleagues from across the province and outside the province. We will begin with a conceptual framework for health equity and its essential components and aspects, including cultural competence and safety within a domestic violence focus. Later, the forum will explore inequities and their impact on specific populations within the context of the Domestic Violence Action Plan. A highlight of today will be the keynote address from a national expert and the 2010 YWCA Woman of Distinction Social Justice, Ms. Deborah Sinclair. We will also hear from our own local experts and champions representing government, governance, DHAs and IWK, colleagues, communities, and providers. We will end our day as we began it, with powerful cultural presenter who will demonstrate the richness of ways of being, learning, and sharing. We listened to you last year, and although you can bet that our agenda will probably always be overambitious, we have provided time for table discussions, facilitated by our Department of Health and Wellness Diversity team and valued colleagues. We will pause for fitness and nutrition breaks to integrate the importance of these aspects in our daily lives. And again, key to this year's forum is an opportunity for every one of us to recommend health system policy and guidelines for domestic violence that will integrate health equity and cultural competence in this policy priority. We need all of you to do this, and we are very honored that you are here. Thank you very much.